Welcome to the San Fernando General Hospital's Emergency Department, or ED. This video will provide you with valuable information on what you need to know about the Emergency Department. The San Fernando General Hospital's Emergency Department is located in the main secondary healthcare facility in the Southwest region, serving over 300 patients daily. As you enter the emergency department, the nurse at the triage station will assess and assign your triage level. Triage is a screening process administered by healthcare professionals to assess the severity of your condition. Triage level identifies your urgency level. This rating is called the CTAS, Canadian Triage and Acuity Scale. Triage enables the emergency department to prioritize your care according to the type and severity of your signs and symptoms, and ensures that the most urgent cases are prioritized. There are 5 triage levels. Level 1. Resuscitation. These conditions are critical and require urgent life-saving interventions. Examples of conditions include heart attacks, internal bleeding, and severe strokes. Level 2. Emergent. This unstable condition requires early medical intervention. Examples include head injuries or unconscious persons. The patient will be immediately taken to the resuscitation room. Level 3. Urgent. These conditions are urgent but not life-threatening. Examples include chest pains. Level 4 and 5. Less urgent. These conditions are non-urgent and can be seen at their local health centers or district health facilities. Examples include flu, headaches, back pains, etc. If you experience minor complaints, you are urged to visit the nearest district health facility or health center. As a patient, you will arrive at the emergency department via ambulance, car, or by foot. Once you have arrived at the emergency department, you will be greeted by our friendly staff. Upon arrival at the triage station, you will be required to present your identification card for correct spelling of name and date of birth to properly identify you on the patient information system. If you have a referral letter, blood investigation reports, and/or x-rays from another health facility, please present them to the nurse in triage. You are requested to cooperate fully with the triage nurse, doctor, or any attending personnel. Also inform us if you are asthmatic or experiencing chest pains. During your stay with us, please feel free to ask questions or raise concerns. At the triage desk, your health information is recorded, vital signs assessed, and triage level determined by the nurse. If you are triaged as level 1, and 2, you will be admitted to the resuscitation room. These triage level 1 and 2 patients are registered via a relative who provides the information, or if the patient is alert, a medical records technician will register the patient, print the records, and provide it to the medical officer who determines your medical plan. After you've been assessed and treated, the medical professional will inform you whether you will be discharged from the emergency department and sent home, or if you require further medical care. This may involve admission into a hospital ward. If you are triaged as level 3, 4, or 5, you are required to be registered in the patient information system. It is important to note that SFGH Emergency Department is first and foremost designed to treat with emergencies. It is not based on first come, first served. The medical doctor will determine which area of the emergency department you will be sent for assessment and treatment. Be advised that the San Fernando General Hospital offers a full multidisciplinary team approach to patient care. As such, if the emergency department medical doctors are of the view that other specialist opinions or reviews are required while assessing and treating you, then the various specialists will be contacted. You may also require assessment by multiple specialists, and while this may be a time-consuming process, you are reminded that this is necessary to ensure that you are offered the best care possible and the diagnosis determined is accurate. Please be patient as the various medical doctors interact with you. Additionally, various diagnostic tests may be required to assist in determining your primary diagnosis, and these tests may include X-rays, ultrasounds, CT scans, or blood investigations. Each of these tests will add to your overall time spent in the emergency department, as the same tests are being requested for multiple patients and results may not be as prompt as you may desire. Once a possible diagnosis has been determined, a decision will be made whether to admit you into hospital or whether you can be discharged. The attending doctor or nurses will inform you of the discharge procedure, as you are required to complete the necessary paperwork. You will also be informed about further medication, treatment, and any arrangement for appropriate follow-up, either at the health center or the hospital clinic. Please ensure that all prescriptions and referrals are stamped at the registration desk located at the entrance of the emergency department. Once you are being admitted to the hospital, you will be assigned to a ward and a bed will be allocated. A medical orderly will transport you to the designated area of the hospital. Please note, there are times when all beds in hospital may be occupied and there's a delay in bed assignment. Once you have been admitted into hospital, it means that you were discharged from the emergency department. You will now be required to wait in the acute medical unit for a bed to be assigned. For patients who can sit, an area in the acute medical unit was designed. And for those who are non-ambulant, you will be allowed to lie on a bed or trolley while you wait to be taken to the ward. We understand that you are not feeling well, and our caring and courteous staff will be happy to make your stay more comfortable. During your time spent with us, if you have any questions, concerns, or suggestions, here are some ways you can communicate with us. Speak with our friendly customer relation officer on duty within the emergency department. Ask to speak to the senior staff on duty, registrar, nurse in charge, for example. Call our toll-free 24/7 available hotline at 87-SWRHA, that's 877-9742. Complete our customer satisfaction surveys, or visit us on social media at Southwest Regional Health Authority. Please be mindful of the following. The use of mobile devices is prohibited while being attended. Photography and videography on the compound are strictly prohibited. Absolutely no weapons or illicit substances are allowed on the compound. Please respect the privacy of other patients. And abuse of staff or other patients will not be tolerated. Only one relative or next of kin will be allowed within the emergency department at a given time due to space restrictions and for your safety. At the SWRHA, we have a team of dedicated and committed healthcare professionals who are caring, committed, and competent. Do have a comfortable stay with us.